Thank you very much. Thank you for letting me speak here today. I'm excited to speak on this topic. The ketogenic diet is a very interesting area of research, and in the past decade, we've seen really an explosion of interest in this topic. As Dana mentioned, I primarily focus on the ketogenic diet in cancer and also neurological diseases. But for this talk, I'm going to try to get a more general overview of the ketogenic diet, and especially focusing on its primary clinical use, which is epilepsy. So I do need to disclose I am a scientific consultant for Prove It Ventures, which is a company that sells an exogenous ketone supplement. So for this presentation, hopefully afterwards, you'll have a better understanding of the history of ketogenic diet therapy, of the proper implementation of ketogenic diet therapy, of known benefits and side effects of this therapy, as well as contraindications. So as you know, we can think of fat and carbohydrate as kind of the two primary energy sources for the body. And of course, protein is another very important energy source for the body, but its primary role is really to replenish body proteins. And so its energy role is kind of secondary to that. And so carbohydrate that we consume is converted to glucose, and fats, when we consume them and metabolize them, they get broken down into fatty acids, and subsequently, in certain scenarios, ketones or ketone bodies. And of course, these metabolites will enter some very complicated metabolic pathways to produce ATP energy to run all of the cellular processes within the body. And what's really interesting is now that we have a very good understanding, for the most part, of the energy metabolism pathways in our body, we're really beginning to learn that these energy metabolites are far more than energy molecules. In fact, they are functional signaling molecules that have very potent effects on cell behavior and processes. And so we are interested in this talk because I'm talking about the ketogenic diet, which is by definition ketogenic, producing ketone bodies. We're interested in the ketones themselves, which come from fat metabolism. So ketogenesis refers to when our body makes ketones. This happens in the liver. And when we look at the requirements for endogenous ketone production, so to get our liver to start producing ketones by itself, you kind of need a reduction primarily in insulin, and that happens with a reduction in glucose. And when you have a scenario where insulin is suppressed, the fat in your stored fats will get broken down into fatty acids. They travel to the liver, where they are broken down by beta oxidation, and then that produces acetyl-CoA, which is used in the mitochondrial matrix of the hepatocyte to be converted into ketone bodies. And those ketones are then shipped out of the liver. So the liver is a producer but not a user of ketones. So the ketones are shipped out of the liver, where they travel through circulation to the rest of the body and serve as a very efficient energy source for the extrahepatic tissues. And beta-hydroxybutyrate and acetoacetate are the two primary ketones that we think of as circulating in the blood. Acetone is produced by the spontaneous decarboxylation of acetoacetate, and it's exhaled in the breath quite rapidly, and that is what's responsible for the fruity aroma that is smelled on the breath of individuals in ketosis. So why ketones? Why does our body make ketones? Well, it's actually a very key component of our evolutionary history. So our hunter-gatherer ancestors regularly experienced episodic starvation. And as you know, we don't have a lot of energy in the form of glucose stored in our body. Of course, our primary storage form of energy is fat. And if we were needing to utilize glucose past about 2 or 3 weeks of starvation, we would have to start breaking down our muscle tissue in our body to produce gluconeogenic precursors, amino acids that can be converted into glucose. And that would really allow us to only do that for about 2 or 3 weeks before we would succumb to cardiorespiratory failure from the breakdown of the muscle tissue. But instead, humans on average can live a few months without eating because we have fat on our body that produces ketones. And these ketones are very important for supplying energy to our very energy-demanding brain during those periods of starvation or fasting. And so human brains have a very high brain-to-body weight ratio. So the human brain uses about 20% of the body's energy, despite only taking up about 2% of the body's weight. And while most of the rest of our body can very efficiently burn fatty acids, the brain is not able to sufficiently derive energy from fatty acids. Some can't cross the blood-brain barrier, some can, but overall they're not a good source to really supply the energy to meet the energetic demands of the human brain. And so ketones were really a requirement to supply energy to the brain, the human brain, which allowed our species to develop or evolve to have the size brain that we have. So ketones play a very important role in our evolution. And in fact, they really are the only other primary energy source for the brain. A lot of times you kind of hear this idea that glucose is really the only thing, your brain absolutely requires glucose, and that's probably true. There's probably some subset of neurons that are obligate glucose users, but the majority of the brain can switch to utilize ketones. And during starvation, ketones can replace glucose as the primary fuel. In this diagram, you can see that ketones are making up about 2/3 of the energy substrates for the brain during starvation. And the gluconeogenic processes from glycerol, the backbone of triglycerides, and gluconeogenic protein can also serve to supply the required amount of glucose in the body, despite reduction or cessation of carbohydrate intake. And so this wasn't always accepted. Actually, it wasn't known for a very long time that ketones could serve as an energy source for the brain. This is kind of an interesting study back when they were really demonstrating this. This was, I think, back in the 1960s. George Cahill and colleagues performed this study in 3 obese, I think it was medical students who had been fasted for about 40 days. And they were keto adapted, so they were making lots of ketones. They had blood ketones that were elevated. They were well in ketosis, and then they administered 20 units of insulin, which induced their blood glucose to drop to 1 to 2 millimolar. This would be fatal if ketones were protecting the brain and supplying that energy to the brain in the face of that severe hypoglycemia. It absolutely would have been fatal. So this was kind of a high-risk, high-reward proof of concept study prior to the IRBs being in place, which you could not do this anymore. But it gave us some really conclusive evidence that ketones are a very good energy source for the brain. So when do you make ketones? These are the conditions in which you induce ketosis. Of course, starvation, which we know of, fasting. Ketogenic fats, there are certain fats, so like medium chain triglycerides, which because of their unique metabolism will go quickly to the liver and get converted into ketones. A new area of interest in the ketogenic research community is exogenous ketone supplements, and these provide basically our ketogenic precursors, which elevate ketones in the blood. And then of course, what is the ketogenic diet? A very low carbohydrate, high fat diet. And this diet was created to mimic fasting. So it had been known for a very long time that fasting could cure epileptic seizures. The earliest reports actually go back to 400 BC. And so in the early 1920s, it was realized that we know that fasting can cure seizures. What if we could mimic the metabolic effects of fasting by eating a diet that is very high in fat? Because when you think about it, when you're fasting, you're kind of eating a diet that's high in fat. It's just coming from your stored fats, right? So this was an idea that was set forth in the early 1920s where some clinicians at the Mayo Clinic said, okay, let's try a very high fat, very low carbohydrate diet to mimic fasting. Here you can see the components of the diet that they tried. about 1 gram per kilogram protein, so an adequate protein level, but not high by any means because protein can inhibit ketogenesis. Very low carbohydrate, 10 to 15 grams per day, and the remainder of the calories coming from fat. And they use a caloric requirement of the basal metabolic rate with plus about 50%. And in the first 17 patients that they tried this on, it was a remarkable success. 59% of the patients became seizure-free during this study, while 23% showed marked improvement. And so that was an amazing progress. And the ketogenic diet was used for a while after that, and its robust effectiveness was really continually supported in the decades that followed it. But in the 1920s and 1950s, we had the development of many anti-epileptic drugs. And of course, when the drugs came on the market, the diet fell out of favor with physicians for obvious reasons. Until the 1990s, there was a renaissance of interest in the ketogenic diet, largely due to some individual families that realized that there are kids out there that are still not responding to these anti-epileptic drugs and not being told that there is another potential way. And so one option for patients with epilepsy is to undergo surgery, and of course that has major risks. And so the idea that there's this diet that has been shown to work and has been known about for 70 years, but is not really getting the information out there, you can imagine that was really difficult for many of these parents to hear. And so there was a parent-led movement that started in the 1990s to really get that information out there and push forward with research and to reinstate this as a common clinical application for seizures. And these two foundations, the Charlie Foundation and Matthew's Friends, have done an incredible job in the past couple decades really pushing that information forward and serving as a resource for information for parents and families, clinicians, practitioners that are interested in ketogenic therapies. Primarily for epilepsy is what they started out with, but really now they're looking at all of these other diseases that are being researched. Okay, so what exactly is the ketogenic diet? So typically the ketogenic diet, when we talk about it in the most strict form, we're referring to the classic ketogenic diet, which is a 4-to-1 ratio of fat to protein and carbohydrate. And this means that about 90% of the calories are coming from fat. That's a very high percentage, of course, which is why, as I'll tell you in more detail about in a second, there are several other therapies that are modifications of the ketogenic diet that have a less severe ratio, maybe a 2-to-1 or 3-to-1 ratio of fat to protein and carb being employed. And so of course the fat is going to be coming from things like coconut oil, butter, olive oil, nuts, fatty fish, MCTs, protein from fatty animal meats and fish and cheese. And remember again, protein does need to be adequate, but it cannot be in excess because it will inhibit ketosis. And a very small amount of the calories coming from carbohydrate and really primarily from high fiber green leafy plants primarily. And when you eat this ratio of macronutrients, your body basically is experiencing a very similar metabolic state to when you're in starvation, and it forces the liver to start making ketones. Now, the ketogenic diet is used clinically primarily for seizure control, but there's a lot of new applications really being understood. About 50% or over 50% of pediatric epilepsy patients who go on the diet will reduce their seizures by over 50%. About a third of them will have over 90% seizure control. And there's some small subset of super responders who have rapid, total, and permanent seizure control when they go on the ketogenic diet, maybe 10 to 15% of patients. And as of right now, there's no clear link between why these patients have this dramatic response to the diet. It might be in that SNP data that we saw earlier. Once 2 to 3 anti-epileptic drugs have failed, the ketogenic diet is twice as likely to work compared to trying another anti-epileptic drug. And it can take time to work. So practitioners really really say it's a good idea to give the diet a good 3-month trial before deciding whether to continue or not. And a lot of patients that do go on the diet can actually come off after 1 to 2 years and maintain permanent or semi-permanent seizure control. There are a number of, what's interesting about the ketogenic diet in terms of its anticonvulsant effects is it seems to have very widespread anticonvulsant effects, working in a variety of seizure etiologies. There are, though, certain seizure disorders in which the ketogenic diet is particularly likely to work, and some of these are listed here. And especially in these very vulnerable patient populations, it's very important that the dietary team that is implementing the diet in these patients are working with trained physicians, supportive healthcare clinicians that know a lot about the ketogenic diet. And it's really important to have everyone on the ketogenic diet team really on board and to have good experience, because there are difficulties, especially in a vulnerable patient population. So this is a recommendation from the ketogenic diet team at Johns Hopkins, where they say that really to successfully implement the ketogenic diet in maybe a pediatric epilepsy condition or case, you need a whole team of individuals that have extensive knowledge on the diet. And it really needs to be acknowledged that this is a process, not an event. There are absolute and relative contraindications for the ketogenic diet. Some of the absolute contraindications would be carnitine deficiencies, like primary carnitine deficiency. Of course, carnitine is important for carrying long-chain fats in the mitochondrial matrix for metabolism. And so when you're eating a diet that's very high in fat, a carnitine deficiency can cause this to be a contraindication for the diet. Anything that is basically a disorder of fat metabolism, like beta oxidation of the various chain links of the fats, can be a contraindication. Pyruvate carboxylase deficiency, porphyria can be exacerbated by a ketogenic diet. These are considered contraindications. Others to be concerned about, but are maybe not absolute, if an individual is really unable to maintain adequate nutrition, depending on the condition that they have, this could make it difficult and not feasible to induce a ketogenic diet in these patients. If the parent or caregiver, if there is one in the specific case, is non-compliant. Liver disorders, because the liver will metabolize these fats. If you have some disorder of the liver, including liver cancer or metastases to the liver from other cancers, that could cause problems. Pancreatitis, gallbladder disease, kidney disorders, these can be overcome, but make it more difficult. There are complications and side effects of the classic ketogenic diet. And remember, these are really that very strict classic 4-to-1 ketogenic diet that I'm talking about. As you'll see, when I talk about the modifications of the ketogenic diet with a less severe ratio, you don't see nearly as many of the side effects, and they're less severe. And in reality, the side effects are very manageable. They're transient, for the most part, reversible, and comparing to some of the side effects of the anti-epileptic drugs, of which this diet is typically used in that patient population, you can understand why a lot of patients or parents want their kids to try something like this. So things like constipation, due to the reduced bulk and fiber in the diet, and this can be helped with laxatives or the addition of fibrous veggies or MCT oil, which can stimulate GI motility. Gastroesophageal reflux can be alleviated with over-the-counter acid blockers. Changes in weight, in kids, especially in kids with certain metabolic disorders. A lot of metabolic disorders, one symptom of them is seizure, and so many kids that go on the classic ketogenic diet for their seizure also have an underlying metabolic pathology that can make this a little bit more difficult. So with kids, you can maybe see weight gain or weight loss, and you would need kind of specific attention to that. In adults, primarily the weight gain is not so much an issue. Most adults will lose weight, but not to a dangerous degree. Hunger. The fat is way more, as you know, calorically dense. So when you switch to a ketogenic diet, the portion sizes are much, much smaller. And so the physical bulk of the food is smaller, and that initial onset can be kind of difficult at times, so it can cause hunger, especially in the first couple of weeks. But really once you adapt and you start making sufficient levels of ketones in your blood, this is going to go away. Due to the nature of the diet, depending on how it's implemented, which of course there's many ways to implement the ketogenic diet because it's made up of foods of which there are many varieties, you can see an increased risk or incidence of certain vitamin and mineral deficiencies. Some specific ones to kind of keep an eye out for would be calcium, selenium, zinc, copper, vitamin D. Just needs to be monitored, and possibly supplementation could be used. Kidney stones, there is a small increased risk of developing kidney stones, and this is just because of the slight acidic effect of the ketogenic diet. Ketones are acids, and this causes an increased risk of kidney stones, but you can use an alkalinizing agent such as potassium citrate to reduce this risk. You can see potentially alterations in the blood lipid profile. This is often transient, so there were some studies in kids that went on the classic ketogenic diet that showed that some blood lipids were elevated a few months into the diet, but actually they were back to baseline at 2 years following implementation. And when you look overall at the data, really it's quite convincing that most blood lipids move, at least the important ones, move in a favorable direction. In the ketogenic diet, typically you see a reduction in triglycerides and an elevation in HDL. Sometimes total cholesterol or LDL could potentially go up. It's not as robust an effect that you see, but it could happen. But there's some interesting data now even showing that potentially that's a subparticle of LDL that is not the atherogenic subparticle of LDL that's being elevated. And LDL in general, and total cholesterol in general, is really falling out of favor as being recognized as a good biomarker for cardiovascular health. So HDL and triglycerides, which are pretty solidly seen as a quite good biomarker for cardiovascular health, they move in the good direction for the most part. Carnitine deficiency, again, just comes back to the fact that you need a lot of carnitine to process a diet so high in fat, may require supplementation. There is some data that shows enhanced bone metabolism in these kids is affected, and so you may require vitamin D supplements. And also in young children who go on a classic ketogenic diet, there's a slight increased risk for growth retardation. And so this just needs to be properly monitored, and supplementation could help to alleviate that. So because of some of these side effects, and also just out of the hope, I think, that you could maybe not be as strict as the classic ketogenic diet and still get benefit. Several modifications of the ketogenic diet have been created and investigated and are currently being investigated. So I'm going to talk about a few of these alternatives. So they were really developed to improve tolerability and compliance. And really the biggest difference is the allowance of more protein and not such a focus on monitoring calories directly, such as requiring gram scales or directly weighing food, although of course it's important to still monitor portion size. And these alternative diets, by and large, they do have, those side effects are less frequent, especially the risk of decrease of growth suppression in the kids and the development of kidney stones. And so these alternative diets are really encouraged in teens and adults, and they really do seem to improve compliance. So the first one is the modified Atkins diet. So when we think of the ketogenic diet, we also think of the Atkins diet, understanding that they're very similar. There are some small differences. Of course, both induce ketosis. You get an elevation in your blood ketones. The modified Atkins is a little bit less restrictive than the classic ketogenic diet, and so therefore it's seen as a viable option for adolescents or adults. If studies have shown that if a child responds well to a classic ketogenic diet, they're probably also going to respond to a modified Atkins diet. Some will respond equally as well, but maybe some won't. And it just kind of depends on the give and take as to if the improvement in compliance is worth maybe a little bit less of seizure control or effect for whatever you're using it for. It might be worth it to certain parents and families. So this is just an example of kind of the differences between the modified Atkins and the ketogenic diet. Of course, you can see a little bit less fat, a little bit more protein, both quite still low in carbohydrate, but a little more wiggle room in the modified Atkins there. In conditions where, such as in kind of severe pediatric epilepsy conditions where a kid is admitted to the hospital for the initiation of the diet, that's sometimes done with the classic ketogenic diet, but not so much with the modified Atkins. It's used clinically in infants less than 1 year. That's still just the classic ketogenic diet. There have not been studies, and studies have even demonstrated that these alternative diets maybe are not effective for children less than 1 year. Or at least there's definitely not enough known about that patient population to know if you could try one of these less restrictive diets. And both of them have shown benefits. Another is the low glycemic index diet developed at Mass Gen Hospital. It does show a similar efficacy in terms of seizure control to the classic ketogenic diet. And of course, on this diet, really, there's a limitation of foods that you can eat, basically any food that has a glycemic index of less than 50. So this opens up a lot more foods to the families or to the individuals going on this diet. And it's recommended that you consume fat or protein with the carbohydrate that are being consumed on the low glycemic index diet to slow the digestion of the carbohydrate. And this is just an example of a sample day of food on the low glycemic index diet, kind of just highlighting that this is really not that bad. It can be done. A lot of people actually eat close to this or like this without any specific medical need. And so it's really, eating a low glycemic index diet seems to be a much more viable option for certain patients. Another is the MCT ketogenic diet. So I mentioned this earlier, but MCTs are medium chain triglycerides. Of course, these triglycerides which contain fatty acids that have 6 to 12 hydrocarbons. These are very efficiently absorbed. They're carried directly to the liver via the hepatic portal vein, and there they're converted into ketone bodies. So when you consume MCTs, medium chain triglycerides like MCT oil or coconut oil, which has a high percentage of MCT oil, you get an induction of ketosis regardless of whatever dietary intake you're consuming. So for the MCT ketogenic diet, you have about 70 to 75% of the calories coming from fat, but the bulk of these are coming from MCTs. And MCTs can cause GI distress, and it's important to kind of start slow and slowly build up a tolerance to these to avoid that. It's uncomfortable, it's not really dangerous in any way, but it's uncomfortable, and you don't want to turn someone off from trying something because they had a very upset stomach from going too fast too quickly. About 10 to 15% of the calories from protein and carbohydrate. So you can maintain similar levels of ketosis, generally similar to the classic ketogenic diet. Now what's interesting also, specifically for use in epilepsy patients, is that some medium chain fats have also been shown to directly have anticonvulsant properties. So this could give you maybe, in certain susceptible individuals, a little bit more bang for your buck. There are certain supplements that are recommended or potentially necessary when undergoing the classic ketogenic diet. especially in pediatric situations, such as potassium citrate, like I said, with the kidney stone risk, calcium, vitamin D, in case the diet is deficient, selenium, the diet can be deficient in selenium, things like carnitine, also omega-3s to improve the omega-3 to omega-6 polyunsaturated fatty acid ratio. The ketogenic diet really can be implemented by anyone who's interested in it. So cultural, religious, food restrictions, food preferences, allergies, these have all been worked out in a lot of situations. And so it really can be used, and it is being used in all continents except Antarctica, of course. And there's growing popularity in some countries more recently where it wasn't quite used before. So what about certain allergies? Of course, it's just important to track very closely what the individual or the child is able to eat, what is tolerated, and then you replace whatever is causing the problem and repair it with some fat that can be tolerated. So for example, if a child or someone has a dairy allergy, you can replace butter with coconut oil, you can replace cream with coconut milk. There are dairy-free other fat sources, and there's a lot of this information online, and that's really one of the major benefits to being in 2016. There's so much information online about individuals giving their own information, but also good, resourced information on specific recipes that are out there. It's incredible how much information you can get online. There are definitely kosher and halal-friendly ketogenic foods and recipes that are all available online. It requires thoughtful and an attentive meal planning and recording, but it's very important to these individuals. Gluten-free, really not a problem at all. As you know, gluten is primarily in foods that are going to be restricted on the ketogenic diet anyway. Vegan, vegetarian, a little bit more difficult in some conditions just because beans or meat substitutes can have more carbohydrate content in them compared to some animal protein, but definitely can be done. And organic, no known reason that you couldn't fully eat organic when you're on a ketogenic diet. There are commercially available tools to assess nutritional ketosis. This can be quite important. There are some individuals who, if their blood ketones dip past a certain level or if their blood glucose rises, that can trigger a seizure quite rapidly. So it can be quite important, especially during initiation and implementation of the diet, to be able to track where your blood ketone levels are at. So there are the urine strips, which measure acetoacetate. These are good, but they're not perfect, so really sometimes they're not a great reflection of blood ketone levels, but they're cheap. You can measure acetone with a commercially available meter that's out there. You can measure your blood glucose and blood ketones with commercially available meters that are out there. I think that the blood measurement is better, but the problem is it's expensive. So the glucose strips are about $1 per strip. The ketone strips can be very expensive. If you're lucky, you can get one maybe $2 or $2.50 a strip, up to I've seen them for $5 a strip. It's insane. It's really hard. I work with rats, and we have to order 1,000 ketone strips at a time. It's incredible, but it offers a much more accurate view of the blood ketone levels. And then right now there are ways to continuously measure blood glucose, such as with the Dexcom, and there are tools in development for doing the same with ketones, but they're not available right now. And so we're talking about elevating blood ketones. Well, what level is optimal? So we kind of tend to consider in the 1 to 3 millimolar range of blood ketones as being kind of an optimal range for being in ketosis. And as you can see, you can get much, much higher blood ketones, and that's really when you are entering a pathological condition. Now, most of you have probably heard of ketoacidosis, and a lot of you, I'm sure, understand the difference, but it's really important because you'll get this question a lot. Ketoacidosis is a pathological condition that occurs when blood ketones rise to very high levels. Over 10 millimolar, but sometimes often over 20 millimolar. And this occurs largely in type 1 diabetics that don't have insulin functioning. A ketogenic diet does not induce ketoacidosis. The ketogenic diet elevates blood ketones in a safe, normal, physiological range. So you can see there's a very big difference between nutritional ketosis and ketoacidosis. And they have the same molecules are in your blood, blood ketones. The problem is when they accumulate to very high levels without that negative regulation by insulin, then that's the dangerous situation. But in a normal, an individual that has an intact insulin system, this is not a problem. It's very interesting being in this community because there is a huge increase in mainstream interest in the ketogenic diet and ketosis. You hear people going keto all the time. It's a huge thing right now, and it's everywhere. There's a keto subreddit that is there's a lot of really good information out there. I'm always amazed at how many people are interested in this. And I think it also has to do with, over the past few years, we've started to see, these studies that have come out and really a reversal in our opinion on dietary fat, and understanding that probably the fear of dietary fat that we've had was not really that well founded, and that there's the link between fat intake and heart disease has been overstated and is being reversed. And even in 2015, of course, the USDA removed dietary cholesterol as a nutrient of concern and did not include an upper limit on total fat intake in the diet. And these are kind of more, these changes are more in line with the data that's been coming out, especially in some large meta-analyses over the past few years. And even leading some interesting conversations on the effect that information has had on the health of the country. So, in my last about 10 minutes, let's go out a little bit outside the world of epilepsy, which is where I focus primarily on the first part, because that's really still the only area where clinically it is widely accepted that this is a completely proven treatment for that condition. What are some other benefits of ketosis? Why might we want to be in ketosis? Ketones provide superior energetic efficiency. So ketones provide more energy per carbon than glucose. They increase the hydraulic efficiency of the heart while decreasing oxygen consumption. And some of the earliest studies were back in the 1940s. The two major ketones, beta-hydroxybutyrate and acetoacetate, were shown that they were unique in a panel of metabolites that were tested, being able to increase motility of cells while decreasing oxygen consumption. More bang for your buck. It's the definition of efficiency. Ketosis, being in ketosis will reduce and stabilize your blood glucose. And hyperglycemia, as you know, is linked to chronic illnesses and inflammation. And so if you have lower glucose, you have lower insulin, and potentially a better effect in all of these conditions, which are linked to inflammation. Ketones actually have been shown to enhance insulin sensitivity. So ketosis in general, but also even exogenous ketone administration will decrease glucose while also decreasing insulin, suggesting an enhancement of insulin sensitivity. And as we know, insulin resistance is a hallmark characteristic of most chronic illnesses, even ones we don't tend to think of immediately, like cardiovascular disease or Alzheimer's disease. Ketosis induces a reduction of inflammation. And this has been known for a while in animal studies and humans, showing that when you're on a ketogenic diet, you have a reduction in systemic circulating biomarkers of inflammation. But what's pretty cool is now we're understanding mechanistically why this might be. And one reason could be the fact that beta-hydroxybutyrate is an endogenous histone deacetylase inhibitor. And this was being spoken about earlier this morning, these class of HDACs. That's the next slide. Beta-hydroxybutyrate in this example, inhibits the NLRP3 inflammasome. So the inflammasome is a component of the innate immune system that induces inflammation. And beta-hydroxybutyrate itself will block assembly of the inflammasome, and you get a reduction of inflammation. And the NLRP3 inflammasome plays a known role in a whole host of chronic diseases. And then it's also been shown that ketones and being in ketosis reduces oxidative stress. And you guys, I'm sure, know what this is, but it's basically, it occurs when you have too many reactive oxygen species being produced and your antioxidant capacity cannot quench that, and you therefore end up with damage to biomolecules. And we see that ketone metabolism decreases free radical production. So at the cellular level, if you look at mitochondria that are metabolizing ketones compared to metabolizing glucose, those mitochondria are making less free radicals. And you also have an endogenous enhancement in antioxidants. And this is what I meant to be talking about a second ago. Histone deacetylase inhibitors are a way to inhibit the deacetylation of genes within our DNA, thus increasing expression of certain genes. And in this study that came out in Science a few years ago, it was shown that beta-hydroxybutyrate acts as an endogenous class 1 and class 2 HDAC inhibitor and specifically upregulates and increases the expression of endogenous antioxidant genes. And this has been shown to contribute to the known reduction in oxidative stress that's shown with the ketogenic diet. Neuroprotection. Most problems, neurodegenerative diseases or neurological diseases, a hallmark characteristic is reduced glucose metabolism and oxidative stress. So as we know, ketones are the alternate fuel for the brain. If you have a brain that has a deficiency in glucose metabolism, it's a good idea to have ketones on board as an alternative fuel. And also, oxidative stress is a hallmark of neurologic pathologies, and ketones reduce that. So we see in many conditions where you have neurodegeneration, and in aging, you have an improvement in neurological function and protection of health of neurons when ketones are being metabolized. Ketones also enhance mitochondrial function. Mitochondrial dysfunction occurs with age. It's hallmark of most chronic diseases, and ketones are thought to improve mitochondrial function by protecting them from oxidative damage. So if you remember, a lot of the free radicals that are produced in our cells come from the mitochondria themselves. So they're very vulnerable to oxidative damage because you have the mitochondrial genome just very close in proximity and mitochondrial proteins, and the mitochondrial genome doesn't have the same DNA repair mechanisms as our nuclear genome. And so you see that for all of these reasons, the mitochondria are susceptible to oxidative stress and damage. And if we can enhance antioxidant capacity, reduce oxidative stress with ketone metabolism, it's thought that ketones can protect the mitochondria. And so, for all these reasons, we are seeing emerging applications for ketosis. Lots of research being done looking at how ketosis can improve general health, prevent age-related and chronic illnesses, act as a prevention or treatment for neurological diseases like Alzheimer's or Parkinson's or multiple sclerosis, anxiety. You have an increase in the GABA to glutamate ratio in ketosis, as well as autism. Brain cancer is really at the forefront of our understanding of the ketogenic diet, being a potential cancer treatment, but other malignancies as well. And athletic performance. These are some of the major emerging applications for ketosis. And just quickly, you can see why, at least for this example, general and metabolic health, very low carbohydrate ketogenic diets can really improve many important biomarkers for health and cardiovascular health, decreasing triglycerides, raising HDL, decreasing your fasting insulin, reducing inflammation, improving weight loss, improving body composition. So, is it feasible? This is kind of an idea. People say, yeah, the ketogenic diet can maybe do all these amazing things, but no one's going to do it. It is doable, absolutely. There are now tons of low-carb ketogenic recipes online, and individuals can kind of tailor those recipes, adding in fat or protein or carbohydrate as needed to meet their specific macro goals. We're now starting to see pre-made ketogenic meal services appearing. Ketogenic snacks. I've had a ketogenic cinnamon roll before. It's actually quite delicious. And then, restaurants. Yes, you can still go out and eat to a restaurant. At basically any restaurant, you can get, a meat dish and ask for, a salad with extra olive oil, get some veggies, put some extra butter on it. It absolutely can be done. So it is feasible. And I think it's important to note that making these options available and having knowledgeable support for the patients or individuals or clients that want to try this is critical. So I thought this was a really important point here. This woman says, a low-carb lifestyle was not as hard and restrictive as I was led to believe. And just having this information available, if someone is even interested in trying it, just knowing that it is doable with the proper support and information, I think is really incredible. And so to help for future information, there are a lot of good information. Here's some practical guidelines for helping to implement some very good books that have a lot of information about implementing nutritional ketosis as a therapy. The Charlie Foundation, who I mentioned earlier, a fantastic foundation for patient support. I highly recommend checking out their resources online. Here's two very great books by Dr. John Rowe and Dr. Eric Kosoff, who are really leaders in the field of clinical applications for the ketogenic diet. They have two fantastic books out with lots of basic science, clinical, implementation information, everything you could want to know. And so I hope, I have 10 seconds left, that was pretty good. Okay, I hope that after this presentation you feel more knowledgeable about the history of the ketogenic diet, implementation of the diet for various medical conditions. Hopefully, you can take some of this information to help patients who are interested and know who might benefit from that. And so with that, I'll thank you and acknowledge this is our lab at USF in Tampa, who works on the many applications of this field. So thank you very much.